So Chrissy, if my gums bleed, what does that usually indicate?
Usually a sign that you have gingivitis, which is inflammation of the gum tissues, the gums that surround your teeth.
Should I be like stopping my flossing if I see bleeding at all?
You should probably flossing a little bit more and making
Mhm.
sure that you're brushing really well and getting all that plaque out from around your brackets and at the gum line.
So don't be scared if you see blood. It means you gotta keep doing it, and then it's just going to become less and less.
Yeah, it should get better and better. It might hurt a little bit more at first, but it'll get better within about a week.
And you want to just help with like doing salt water rinses, like a little teaspoon of salt with some water, and swishing with that every night is going to help reduce that inflammation as well. With gingivitis, what happens with if it gets too severe?
It can turn into a different form of gum disease, one that we call periodontitis. This is when the inflammation goes from your gums to all the support structure that holds your teeth in your mouth. It can start to cause the bone around your teeth to disappear.
Typically, we get gum disease like sometimes if there's like plaque that's mineralized. So plaque that's been sitting there for a long time, it's going to start to harden. And once it hardens, it sits along the gum line and then makes the gums bleed. So the body just doesn't like it. So it's causing an inflammatory response from our body because the body's like, get this out of there. So think of having a splinter underneath your skin. Once you get that splinter in there, it causes a lot of bleeding, a lot of swelling. So when you get your teeth cleaned more often, it's like removing that splinter. Usually once that splinter is removed, then it's going to the swelling will go down and we'll get good healing, and then there'll be less bleeding as well. But if it's left for a long time, that hardened calcification, it's going to be very toxic to the bone. It's going to start to eat our bone away, and bone is needed to hold our teeth in place. And we don't want to wear dentures at such a young age, right?
Susan, how common is gum disease?
7 out of 10 Canadians actually get gum disease once in their life. That's why it's so important that we get it under control and patients are educated so that this gum disease does not get more severe, because it's a silent disease and we don't feel it until it's in its severe stages.
And can it affect more than just your teeth?
There's a huge systemic link with gum disease because our mouth is a mirror to our body, especially our heart. So whenever there's a lot of inflammation, then that inflammation can actually start with our mouth, and then when the gums bleed, the bacteria can actually enter our bloodstream, which can spread systemically. And then it can actually affect different parts of our body, such as our heart, causing damage to those organs. And did you know that diabetes, heart attacks, strokes, Alzheimer's, that's all related because of the same type of bacteria within our mouth? Research has shown that.